Good afternoon. I know that I don't have to remind people sitting in this room, especially after we heard such a brilliant presentation, that hepatitis C presents a great burden to public health, and that in Canada, the main way of HCV transmission is through the illicit drug injection. I, however, have to bring up the fact that the profile of injection drug user in Canada is changing. And recently, the new population of injection drug users has emerged and grew, people who inject prescription opioids. In Montreal, this population have more than tripled during the period from 2004 to 2009. In the previous studies of our group, injecting prescription opioids was shown to be an independent predictor of HCV transmission, with the adjusted hazard ratio of 1.9. Well, to know why this population may be at increased risk for HCV transmission, we need to know who they are. What are the difference in characteristics between PO injectors and non-PO injectors? In line with this, we designed the quantitative study, and the study objective was to examine socio-demographic and behavioral characteristics, as well as living contexts and drug use patterns among injection drug users of Montreal who inject prescription opioids. The participants of our study were members of the prospective open cohort of injection drug users of Montreal, the HEPCO cohort, that was founded in 2004 to study the determinants of HCV and HIV transmission. The participants for this study were followed between 2004 and 2011. They were recruited by street-level recruitment and through the community programs. To be eligible for HEPCO, the participants should be 18 years or older, reside within the Montreal area, and inject drugs within the past 6 months. The data were collected during the semi-annual interviews with the use of validative extensive behavioral questionnaire administered by trained interviewers. We adopted the instrument from the previous studies and pilot tested it in target population. Additionally, blood samples were collected for HCV and HIV testing. This study design was a cross-sectional analysis of a baseline data. And we further analyzed data by descriptive statistics, by varied comparison tests, and logistic regression modeling. We had 1,243 participants in total, 83% of them males with a mean age of 38 years. Around 1/3 of them reported injection prescription opioids in the past month. Regarding the socio-demographic characteristics, the mean age of PO injectors was found to be significantly lower than the mean age of non-PO injectors, with the mean age difference of 7 years. We found an interesting data concerning the migration to Montreal. We found out that more than half of our participants who injected prescription opioids were not original Montrealers and migrated to Montreal at one point in their lives, comparing to 70% of original Montrealers among the non-PO injectors group. Of those who migrated, greater proportion among PO injectors comparing to non-PO injectors came from the other regions of Quebec province, and almost 3 times greater proportion of PO injectors comparing to non-PO injectors came from other Canadian provinces and USA. Polydrug use was linked to the non-medical use of prescription opioids in previous studies. In our study, we specifically evaluated the specific drug use patterns. And we found out that greater proportion of prescription opioid injectors comparing to non-PO injectors reported co-injecting heroin, which was actually expected. What was new, we found out that PO injectors, the greater proportion of PO injectors was using also amphetamines, non-injectable, and almost three times greater proportion of PO injectors comparing to non-PO injectors who use non-injectable amphetamines, and almost 2 times greater proportion co-used tranquilizers. Sharing syringes and injection equipment are 2 well-known determinants of HCV transmission. In our study, greater proportion of PO injectors than non-PO injectors reported engaging in both of these behaviors. We also evaluated other characteristics that were linked to the increased risk of HCV transmission in the previous studies. We found out that PO injectors, a greater proportion of PO injectors comparing to non-PO injectors, was reporting having unstable housing conditions, injecting in public places, and slightly greater proportion of PO injectors comparing to non-PO injectors reported the history of incarceration and engagement in prostitution. Well, after we found out what is the difference between the characteristics of the 2 groups, we moved on to evaluation the interplay of these characteristics in the multivariate logistic regression modeling. In our final model, 9 factors were found independent determinants of PO injection. In literature, there are mixed data regarding the age of PO injectors, although most researchers report them being younger than non-PO injectors. In our study, we found a strong negative association between the age of injection drug users and PO injection. So with the increase in age, the probability of BPO injectors decreases. Strong positive association was found between migration to Montreal and PO injecting, with the strongest association for those who came from outside of Quebec province. PO injectors were more likely to report unstable housing conditions and to inject in public places with the adjusted odds ratios of 1.8 and 2 respectively. Regarding the co-use of other substances, the strongest association was found regarding injecting heroin, followed by co-use of tranquilizers, followed by co-use of non-injectable amphetamines. It was also found that PO injectors were more likely to be HCV positive, but not HIV positive. We made the following conclusions. Our study suggests that PO injectors represent younger and probably more socially vulnerable population of injector drug users. We showed that tranquilizers and non-injectable amphetamines are independent determinants of PO injection. There is a possibility that the prevalence of PO injection in Montreal increases partly due to the migration from other regions of Quebec province and outside of Quebec. Additionally, our findings raise concern about the increased vulnerability of PO injectors comparing to non-PO injectors for HCV and HIV infections, because many factors that we found independent determinants of PO injection were linked to the increased risk of blood-borne viruses infections in previous studies. Based on all above mentioned, we also suggest that adapted harm reduction and prevention strategies for PO injectors should specifically target young population, co-users of tranquilizers and amphetamines, and those who came from outside of Quebec province. Additionally, the HCV prevention strategies for PO injectors should address specifically unstable housing conditions, as this very well-known determinant of increased risk for HCV transmission was shown to have a strong positive association with injecting PO in our study. At the end, I wanted to thank everybody who contributed to the study, and thank you all for your attention.
Thank you so much. Is there anybody that has any questions? Fantastic presentation. I guess I'll ask one question for you then. Really interesting. I know you didn't touch on this, and it wasn't the part of your presentation, and it maybe is a bit of a tough question, but do you have any insight from either the work that you're doing or elsewhere, what is facilitating the initiation into prescription opiate injecting? I know it's a very complex but do we know anything from the literature, or is this sort of an area of future research that you're sort of working towards looking at?
Yeah, I mean, it's a really interesting question, and I wanted to say something about it, but the thing is actually that we did not specifically look into this, and we did not evaluate this, but I've read a lot of literature, so I know that if you are right and most of your injectors are young, that it could be just experimentational like spirit, among young people. And it may be that, well, they start from something they can easily acquire, like the prescription opioids or benzodiazepines, and then it's just not enough, and they try to do something else, and something else is to inject. So there are other factors that could be there, but I'm not the one to talk about it.
No, that's great. Thank you so much. That's great. So excellent presentation. So thank you so much. Well.